what I know now from the program, Change the Rivers Flow. So I'm able to help others go through this, and sometimes I do the counseling myself. So thank you very much to Change the Rivers Flow program. It really helped me, and I'm happy, I'm happy, I'm happy.
African people are known for their different cultural practices. Inasmuch as culture is a positive force in our lives, there are also aspects of our cultures that lead to a patriarchal or male-dominated society where men hold the political and economic power and make most of the decisions and often all decisions that relate to sex. It is condoned for men to have many different sexual partners, and women cannot confront them about this. The Changing the Rivers Flow program enlightened communities to start understanding that as much as culture is beautiful and should be respected, there are some harmful cultural practices which need to be addressed if HIV is to be defeated. Communities re-examined their cultural practices and addressed the harmful ones. Common cultural practices that were modified include polygamy, where man could marry more than one wife, widow cleansing, where a family member is expected to have sex with a widow after her husband has died to remove the death spirit of the man who has died. Forced or arranged marriages and male circumcision are some of the cultural practices that communities looked at and decided to do differently by stopping the practice of forced marriages and using one razor blade during male circumcision, with some linking the traditional male circumcision to medical male circumcision. Girl pledging is one cultural practice that is common in Zimbabwe. If a family member kills someone from another family, a girl is pledged to the bereaved family so as to appease the avenging spirit. The girl in turn is supposed to give birth to a child who will replace the deceased. The girl's interests are not considered, putting them at risk of being infected with HIV, as they are given a husband whose status they don't know. So how did Changing the Rivers Flow program change this? Yes. What has changed is the issue of girl pledging. There used to be a law that those who are bereaved need someone to replace the deceased, cattle, chicken and goats. But this changed after they learned that girl pledging should be paid using money, so that the man goes to marry a woman he loves, somebody of his age, so that people do not laugh at him. Wife inheritance is one cultural practice that is practiced in many African countries that puts women at risk of HIV infection. If a woman's husband dies, the wife is inherited by her husband's brother without considering either's HIV status. After the implementation of the Changing the Rivers Flow program in Namibia, communities are now changing.
Before, if the husband passed away, a wife have to be inherited by a brother of the husband. Whether they are not tested for HIV, they don't know what was the cause of the death or something like that. But nowadays, people know the danger of HIV. They are going to the clinic for the testing before even engaging in sex. I cannot say all of them, but they are the majority. Now they understand the effect of HIV transmission, and they change a lot on the cultural practice.
Shelta Simbaneuta from Zimbabwe is a beneficiary of the program. After her husband's death, her in-laws tried to force her to be inherited. This was the period when she had started taking part in the Changing the Rivers Flow program. Because she knew that her husband had died of an AIDS-related illness, she did not want to risk her life and that of her brothers-in-law who were competing to inherit her. I refused to be inherited because I knew that my husband died of HIV. If my brothers-in-law inherited me, then they would be infected with the disease and pass it on to their wives, and it would spread in the entire homestead where I was married. Tayavanu Sithole, who valued cultural practices, is a beneficiary of the program. After his brother died, he coerced his brother's wife into marrying him as his inheritance, even though she had initially refused. Their relationship resulted in him being infected with HIV. The program opened his mind, and now he has few words of advice to other men.
Never have a sexual relationship with another woman or man before being tested for HIV.
Polygamy is one practice that cuts across all countries, with the number of wives that a man has showing his sexual prowess, thereby earning him respect amongst community members. This, however, puts women at great risk of HIV infection, as a sexual network means HIV can enter at any time. The program created awareness amongst communities, and this practice is changing significantly as women are now empowered on the relationships they can enter into. Prevention is one of the key interventions of the program, starting with people getting to know their status. Before the implementation of the Changing the Rivers Flow program, not many people were willing to undergo an HIV test, with those who test positive facing a lot of stigma in their communities. Men were not allowing their wives to go for voluntary counselling and testing, with some women also fearing their husbands. Now, undergoing an HIV test has become almost a routine to communities, as they are aware of the benefits, with stigma also going down significantly in all the countries where the program is implemented. With this program, people can now easily talk about HIV and can freely go to clinics to seek HIV services.
We have seen a very good fruit out of that, because people have gone to test, people have gone to circumcise, people have started, the people who have got 2, 3 wives have gone to check all of them, which is a good thing. Even before, it has not been happening.
I think the stigma now is a bit stabilizing. People are seeing that the testing, brings changes in their lives. So it's not that high as in before this program came in. So because the people now are testing, before they were not testing because they were afraid of discrimination and everything. So I think them coming forward and testing means that the stigma is a bit low now.
Changing the rivers flow has helped a lot. People are getting tested. Even myself, I get tested and I go back again after 3 months and get tested. HIV and AIDS prevalence has come down, so we don't have to visit as much because it is better than it used to be. Having undergone VCT and seeking treatment services, community members started seeing people's health greatly improving, thereby reducing chances of reinfection and preventing deaths.
I'm very happy to say that in our community we used to have about 4 bedridden patients through HIV in our villages. One village could carry about 4 or 5 patients. But now, because of the access of ARVs, the situation is almost reversed. I could say it has reversed because we do not have bedridden patients due to HIV.
The Changing the Rivers Flow program empowered communities with information which resulted in behavior change, with condom